Imogen, I'm going to begin by showing you what your attachments look like in the mouth. So these are tooth-coloured bits of composite. They're very hard to see, but I've got a bright light on so you'll be able to see them. So if you want to have a look at that in the mouth there for yourself, and I can lift that up a little bit, you can see that they're incredibly discreet in the mouth, but what they are going to do is they're going to add an extra key to your aligner to keep them into place for yourself. All right? So with that, I'll take the mirror from you, and I will begin by showing you what your aligners look like. So this is your aligner bag. Every aligner comes like this, and it comes sealed, and it also is numbered for you. So it's nice and clear which ones you go up to numerically. All right? This is also very easy to write on with a Sharpie or a biro. So if you're more of a visual person, you can write your date of putting in and your date of change on there as well for yourself. All right? So with your permission, I'm just going to break the seal for yourself. It's hard to see. If I take that off, you're going to then go in the bag and pick just one out first. All right? That's it. So that's good, I'll take that. So you've got two hands, so that's your upper first. And what I'll show you to do is you're going to aim your front teeth in their correct slot first. Tell me if I need to get any clearer for you. And you can begin to start pushing down for yourself. Well done. You can hear some clicking and some clicking into place. That's excellent. What I'm going to show you, which may happen to you throughout treatment, you did beautifully by the way, but on the model, at some point during your treatment, you may find that your aligner is slightly wider than your actual teeth. So what you may have to do is not just push it down because you'll get stuck, but you'll have to roll it in and down at the same time. All right?
It's at the same time as?
Yes, it's best in the beginning with any new aligner is to start in the mirror. Try not to do it blind because you do not know your strength. So look in the mirror, do it slowly and gently, and you can see in a magnified mirror where you need to go. But just rolling in is a really good tool, but you may not need to do it at all, but it's best to show you. There's your other one if you want to pop that in for yourself. Well done.
Thank you.
Here we go. So this is the lower, same principle. Aim for your front teeth first. It's always the right idea. And you can begin pushing it. Good clicking sound, and you're brilliant at pushing it all down. You must never bite on it until it's all perfectly seated, because if you bite on it when it's not in its correct slot, you could buckle the aligner. But you didn't. That was beautiful.
Open it a little bit.
So, I'm then going to show you, apart from your aligners, probably the most important part of your treatment. These are called Chewies. And what they are is what they're called. You chew on them. So if I was to demonstrate with how to hold it, with your aligner in your mouth, you're going to hold it between your index and your thumb, and you're going to bite down right at the back and hold, and move forward and bite down and hold. This is incredibly important at getting the aligner to fit really, really well. So if you give yourself a real big bite there, and I'll explain what that means. Excellent. I'm going to use a certain tooth as an example as well for you. Good. So can you feel, without me telling anything more about it, can you feel that it just feels a little bit more snug to the tooth?
Yeah.
It feels a little bit more forceful. What the difference between that and not having that, Chewy, is that your aligner may not be fitting exactly 100%. So I just saw when you chewed on especially your lateral tooth here, the gap between the aligner and the tooth disappeared. And that's what we want. We want that really snug fit, because at the moment everything's looking pretty damn perfect. All right? Yeah. And they're all seated very lovely for yourself. You get two Chewies. I would advise that you keep one on you at all times, and then when you're eating and snacking throughout the day, I'll take that for you.
Okay.
You can pop that back in and chew on it as soon as you change your aligner and put it back in. All right? So if I move this over here. Next, I'm going to show you your box. This is what every single patient for Invisalign gets. It's a magnetised box that has a manual, so if at home you've forgotten what I've said, or if I've gone too quickly, just refer to the manual and you'll be able to find an answer. Alright? So this is the box. If I pull the ribbon, the box gets released, and this is very thin and very strong. And this is for men that maybe put it in their jeans pockets. It needs to be that robust. And both aligner fits in there together alongside a Chewy. So as long as you keep that all together, you will be absolutely fine. Because when your aligners are not in your mouth, they must be in a box. Okay. Because I myself have put one in a napkin or a tissue and they've gone walkies. So just be really smart about it. Also, dogs love aligners. I don't know if you have one, but they will make a beeline for it because it smells like you. So that's what they want. This here, I'll show it to you. This is cleaning crystals. This is basically like a denture solution that you put in a glass and it's powdered. So you can soak your aligner to get rid of any debris. We like this, but the best way to clean an aligner is with cold water and a toothbrush. No toothpaste, because toothpaste is very abrasive and it can get into the corners of the tooth where you just cannot get it out again. So that's the best way to clean them, we think.
You can also keep the cleaning crystals for your retainers later on.
Yes.
Because obviously you change your aligners every 2 weeks, but your retainers you're going to keep for long term later. So you really want to keep them clean long term.
Okay.
Brilliant. So that's your little bag. All right. In a minute, I'll put everything in the bag so you can have a little bit less of free, a bit more free arms. This here, this is what you're going to use at home to keep on top of your pictures. Dr. Einfeld will have sent you a link to the app to download it. And basically, you're going to use this at home. It's like the little board game that you have where you have to speak really funny. You use this to take your pictures. You may need somebody to help you, as some of them are slightly side profiled. But as long as you've got somebody on hand to help, that's pretty good. So if I was to ask you to pop this in your mouth, this, if I was to do it on you, the big, large section goes on the inside of the lip. And it is quite bendy, so you can really get that in there for yourself. So if I hold a mirror out for you, I'm sure you've played the game before. Excellent. That's exactly right.
Can I take it out?
Yeah. No. Nobody ever likes that bit, I assure you. So that's what you do. As long as you do that when the app prompts you, it tells you to do it. So you don't often need to think too much about it. So keep every single thing together. And it's really important that you take out your aligner on day 14 and you're going to change up to your next one. You pop your number one back in this bag, back in its actual bag with number one on it, and then open your next one. We've had instances where a patient's opened multiple bags and got a bit confused. So as long as you take that set out and put that set in its correct bag, move up to the next, you won't get confused. All right, so do not throw any away. No matter if you get to number 16, keep number one, because if for example you're unlucky and maybe lose one or lose one coming up, you can stay at number 15 or whatever and just stay put, rather than having to just go right back to the beginning. So just keep them all. You never know, you want to be safe than sorry. So with regards to wearing your aligners, you know to wear them every day, all day, 22 hours a day. So you take them out to eat and drink. Anything other than water, they must come out. So you must brush before putting them back in, as you do not want any food debris sandwiched between the aligner and the tooth. All right? As long as you're keeping yourself clean with, you brush your teeth normally with toothpaste and a toothbrush, but just water and your toothbrush for your aligner, and that is perfectly fine. You will never get them cleaner or fresher looking than the first day you put them in. It's always a nice day to change up your aligner. So you will have some wear and tear by day 10, day 13, but you're going to be on a fresh one very soon. With regards to diet, there's not many things that you have to restrict. The only thing we would say is very heavy spice. So something like turmeric or paprika will send not only your aligner, but the little bobbles, the attachments on your teeth, they will go bright yellow. It's really not a good look. Yes. By all means, if you would like to have one, just do it very sporadically. Don't do it lunch and dinner multiple times. Don't restrict yourself in that way, but you may experience some staining, so it's best to warn you. Other things like heavy coloured red wine or squash, they may look discoloured in the beginning when you've just had your fresh drink, but as soon as you brush those teeth and the aligner, that colour disappears from you, so don't get shocked by it, all right? With regards to speech, at the moment it's like a new pair of shoes. You just need to get used to the feeling of it. But as long as you're practicing your S and your T sounds, anything that makes a lisp in the mouth, that is a brilliant way to make yourself sound as normal as possible.
I've got a good one for you. Try to say Staplehurst straight teeth.
Staplehurst.
I know.
Staplehurst straight teeth.
Exactly.
Just remember one thing is I do a lot of public speaking when I teach dentists teeth straightening, and I can hear myself talking differently when I'm wearing aligners, but other people don't notice. So you might notice yourself sounding a bit different, but that doesn't mean that other people will.
Okay.
And the thing I found really, really important in the beginning was to keep yourself hydrated. At the moment, they may feel a bit dry in the mouth. The mouth is going to be a little bit drier. So a bottle of water with you during the first few days is a very good idea. It gets you kind of used to it a little bit better. Okay. I don't know if I've missed anything, but I'm sure my list will tell me. I've showed you the box. What we just need to demonstrate is you put them in beautifully. We just need to take them out because this bit is a little bit trickier. So you put in beautifully with 2 hands or 2 fingers. What I would advise is don't use 2 fingers to take it off, because if I show you on the model here, if you can see the attachments, if I try and pull off from both sides, it engages the attachments even more into the liner. Okay. So you're kind of pulling it against nothing there. So what I would advise is right at the back where there's no teeth anymore, you start flipping the aligner out with your fingernail. And then you gradually move 1 tooth forward, 1 tooth forward, 1 tooth forward, and then it comes out.
Okay.
Don't be disheartened and don't be rushed. Take as much time as you need and do it in front of a mirror in the beginning, all right?
Okay.
So we'll start with whatever preference of side, and you've probably got good fingernails. Excellent. That's it, and you'll hear it as well. So just go back on yourself a little bit until that back tooth.
No fingernails.
That's okay. It's really just, this is as messy as it's going to get, so I promise you.
Right at the back, as far back as you can.
I think I've moved that or not.
Yeah, and then just lift at the back. Yeah, and keep lifting at the back, even more. Keep lifting.
That's
keep
it.
Lifting. Keep lifting.
That's it.
Keep lifting. Good. Keep lifting.
You can see now. Excellent. You've worked your way forward. That's excellent job. So try and use your thumb maybe like that against gravity.
I've got enough nails out.
Me neither. Don't worry.
Just keep lifting at the back.
Just keep lifting.
Just keep lifting at the back, at the very back. Yep.
That's it.
And then you carry on. Yeah. People often go forward too quickly. They really want to stay all the way until they've lifted it up at the back, and then you can lift it.
There it goes. It pings. Promise you'll do that in 3 seconds flat, both the top and the bottom, by the end of the week. You'll have a side that you prefer as well. You might not know it yet. That's fine. That's it. That's it. Excellent. So go creep forward a bit.
That's it.
She's excellent. Don't worry. As messy as it'll get, I promise you. Here's a tissue.
But that is the way to do it.
Excellent job. That was excellent.
People jump forward too quickly, and then they wonder why they don't come out. So just make sure they lift them up at the back.
Okay.
You can pop that back in for yourself because you're going to have that in for the rest of wherever. If you want 2 hands, I can hold. Well done.
Thank you.
That's okay.
At the top.
That's the top. Well done. Excellent. And then in a minute, when you have a moment, we can give you some Chewies and you can crunch that on there properly for yourself. Fantastic. So just a tiny roll in on that side. Did you notice that? Just ever so small. But that's what rolling in looks like. Excellent job. So if I just went and got you a Chewie, just to stamp that back in, you'll have this in your box, but this is just for now, she says. Here it is.
Do I need to worry about where I grind my teeth at night? That's fine, these are fine for that?
Absolutely fine. On the contrary, actually, the fact that you bite together on your teeth helps. So even during the daytime, even when you're not using Chewies, if both teeth bite together, that actually helps because you're actually pushing the aligners down over the teeth.
Oh, okay.
So very good question.
So it's fine.
Yeah. The only thing you might find is that you actually start wearing a little bit on the aligners. That's not a problem. After 2 weeks, you have a new one anyway.
Do they get sent to me then?
No.
You get them now.
Yeah.
Oh, I get them all? Okay. Okay.
So if you just want to grab a Chewie, again, just hold it between your index and your thumb and get that right to the back there. And especially focus here.
Try to bite together and hold for about 5 to 10 seconds. It's okay what you're doing just to push them in a bit. But when you do it in the evening, where we say about 10 minutes, try to bite and hold. Yes. And then bite.
Excellent.
Perfect there. That is exactly textbook. bite and hold exactly. Look how nicely they're fitting over there. You can see how snug they're fitting over the teeth. That's brilliant there.
It's definitely those central teeth there that's made so much difference.
Really, really good.
Excellent.